All right, you're welcome, Mrs. Bola. Okay. So it's another session of Livestock Hour, and we know what we do here. We share tips and learn about livestock, and then we tend to ask questions and get the necessary knowledge to ensure a profitable production for our businesses. So on today's session, we're going to be looking at effective vaccination practices for profitable livestock. So please, for those that have been attending livestock hour, you know how we do it here. That you would, when it comes to session of, you need to wait for um the session of question and answer to ask your questions. So if you have any questions that you have during the course of the teaching, during the course of the lecture, all you need to do is just pen it down. And when we get to that session where you can ask questions, then we are going to make it open. All right. So without wasting our time, I'm going to hand over to our facilitator now so she can take over. All right. So Dr. Tewe, please over to you. Thank you.
All right. Good evening, everybody. How are you all doing? It's good to be here. Okay, so today we're going to be discussing a very important topic. Very, very important topic. It's very important both for our livestock, our poultry, and also humans too. So today's topic is effective vaccination practices for profitable livestock. And vaccination is a very powerful preventive measure. You know, we have the preventive aspect and then the control aspect of disease, controlling diseases, preventing diseases. So vaccination falls under the preventive measures. I'll start by saying what is vaccination? Vaccination is the administration of a vaccine to help the immune system to develop immunity from a disease. That's like a very simple definition of vaccination. Administration of a vaccine to help the immune system of an animal, both animals and humans actually, but we are dealing with animals in this section, in this session. So it's an administration of a vaccine to help the immune system to develop immunity from a disease. And vaccines in general, they contain a microorganism or a virus in a weakened state. So when we're talking about vaccines, they are like an active like the active microorganism, like probably the popular one of the most popular diseases of, let me say, poultry is Newcastle disease, and it's a viral infection. It's a viral disease. So Newcastle Lassa vaccine now, which is used to vaccinate a flock against Newcastle disease. So Lassa contains like a weakened virus, that the weakened Newcastle disease microorganism. So when it's introduced to the animal, it helps the animal to develop antibodies. Antibodies generally, they're like the soldiers present in the body to help fight against disease agents. So when these vaccines are introduced to the body, because it's in a weakened state, it will not cause the disease, because actually you're introducing the microorganism into the system of the animal, but it will not elicit probably like a disease state. It's just going to help the body to develop antibodies, soldiers against these disease agents, so that maybe when a virulent form of the disease comes in contact with the animal already has soldiers on ground, which are the antibodies, to help fight against the infection. I hope that is clear. I hope we all understand what I just said. I hope I'm not just saying gibberish and we all understand. Please, can I get some reactions to know that you're following me? Okay.
Please let's get reactions. Thank you.
so that I know that you can hear me and you're understanding what I'm
We
saying.
can hear you. We can hear you. We understand.
Okay, thank you. Thank you very much. Thank you. Okay, so vaccination, however, combined with good biosecurity measures. So you won't just say, okay, I'm vaccinating my birds and I'm not doing some other things to also prevent, because like I mentioned earlier, vaccination is a preventive measure. There are also many other preventive measures, to make sure your birds don't come down with disease agents in the environment. So while vaccination is important, it should also be combined with good biosecurity practices such as good hygiene, quarantine, then limiting contacts to just anybody into your farm, which helps to generally minimize the risk of diseases. So we have different types of vaccines. The common ones are the live vaccines. We have inactivated vaccines, and then we have the recombinant vaccine type. So like the different types of vaccines that are available to livestock and poultry birds. So now we'll move to the importance and the role of vaccination in poultry and livestock health. Why is vaccination very important? Vaccines help to teach the immune system of our animals to create antibodies to protect them against the diseases, because in our environments diseases are always like everywhere. They're everywhere, just like for humans now. Malaria, mosquitoes are everywhere, so we are always like in contact with mosquitoes. So what do we do as humans? We place different measures on ground to protect ourselves against mosquitoes, right? So we don't come down with malaria. So the same for our animals too. Vaccines will help them to, when they come in contact with these disease agents, they already have soldiers on ground, which are the antibodies, to help them fight against these diseases, especially when it's now combined with good hygienic practices on your farm. So, like I said, it helps to train your immune system to create antibodies so that when they're exposed to the diseases, they do not come down with it. And it is very crucial that you employ these vaccination practices. It's good you employ them. It's crucial in poultry and livestock farming to prevent diseases. And because we know how much diseases affect our animals, once diseases comes in like this, some of them will start losing weight. We have a lot of mortalities. You will spend a lot of money. So these are the reasons why you should employ good vaccination practices to prevent mortalities, to improve the growth rates, because once they are down with a disease, they will lose weight, which will actually take them like some steps behind. Like when your birds are supposed to reach a particular weight within a particular period, because they are down with a disease, they are not able to reach that weight at that particular time, and so it delays their growth rates. It also vaccination also helps to reduce mortalities, because when you're losing birds, you're losing money, and then while your birds are sick, you have to be spending money on drugs. And also it ultimately helps to enhance the economic benefits, because while you're raising the birds, you're raising them for to gain profits, to have profits. So it ultimately helps to enhance your the economic benefits. So I'll talk about an overview of common poultry diseases and their impact on farm productivity. I'll mention the very common ones that we know. For poultry, because I know we have more of poultry. I think we have more of poultry farmers here. For poultry, we have Marex. Marex is a viral disease. We have Newcastle disease. We have infectious bursar disease. We have infectious bronchitis. We have egg drop syndrome. We have fowl pox. Then for people raising maybe goats, cows, you get sheep, the ruminant animals. We also have the common PPR. We have FMD and the likes. So talking about all these diseases. So all these diseases now, some are viral. A lot of them are viral. we have a few bacterial diseases too that have vaccines to prevent them. So Marex, for example, is a viral disease and there's a vaccine for it. But most times the vaccine for Marex is usually given at the hatchery. And that's why it's very important for you to get your birds from a very reputable source. So you are sure that I actually giving them this Marex vaccine at the hatchery, because it's usually done at day one, the day when those birds are hatched. So it's important that you get your birds from a reputable source. We have the likes of Newcastle too. Newcastle is very common. And there's a particular vaccine that's actually given to them at day one. Then you also have to do a follow-up vaccine too once they get to your farm. Then IBD, infectious bursar diseases, the common Gomboro vaccine, the one they call Gomboro. A lot of people just call the disease Gomboro. So it's Gomboro. We use the Gomboro vaccine against IBD. Then we have infectious bronchitis. They use the IB vaccine against that. We also have EDS, which is very important for people raising laying birds. The egg drop syndrome vaccine, the EDS vaccine, is important for people raising laying birds. We also have fowl pox, which is also very common. And I would have loved to maybe do a breakdown of all these diseases, but I'm very sure a lot of people are very familiar with some of these diseases I just mentioned. And so it is very important that you know your environment, because these vaccination practices is also, I don't want to say relative, but if you're in an environment that some of these diseases are very prominent, like very endemic, because we have some areas now, the way I explain malaria to humans now, we have some areas where the amount of mosquitoes is a lot, like a lot. So people living in those kind of areas have to do so much more to protect themselves against mosquitoes. It's the same with poultry and livestock. So if you know you're in an environment where some of these diseases are very prominent and endemic, you have to do so much more to make sure that your flock does not come down with these diseases, because most times some usually have permanent like some permanent consequences on the flock, and some don't, but some do. Like Marek now, most times when your flock comes down with Marek, it's usually very difficult to control. So for Newcastle, I've heard a lot of people say, oh, Newcastle is very prominent, is very endemic in this area. And let me say, okay, if you are moving to maybe a new area where nobody has maybe raised birds before, a very new area, probably nobody has raised birds there before, it's very likely that some of these disease agents might not be endemic in that area. It might not be, compared to people that are raising birds in probably farm settlements, or maybe there are like several poultry farmers in that area. But if you're like in a new environment, most times you might not find, your birds might not, actually, if you're doing a very, very good job with your hygienic practices, biosecurity measures, and the like, your birds might not likely come down with some of those diseases because they're not usually present, because maybe birds have not been raised there before. But still, you still have to make sure you still vaccinate them. I know some farms now that for Newcastle, they usually have to like be doing their vaccination for against Newcastle disease. They have to like do it every month. Some do it every 6 weeks, and some they might just do it every 3 months, and they are fine. So it still depends on the environment. Once you know the environment that this particular disease is very endemic in this place, you have to like do extra effort to make sure that your birds don't come down. Okay. So, points. Can I get some reference, please? Okay. Okay. Thank you. Okay. So I think I already mentioned the benefits of effective vaccination to reduce disease incidence, to control disease outbreaks, to reduce morbidity and mortality, and also to enhance growth rates, to improve feed conversion, and also to increase production. So let's move to vaccination schedules and protocols. So, like I said earlier, specific vaccination schedules can vary depending on the type of poultry, livestock, the age of your flock, and also the local disease prevalence, like how prevalent the disease is in your different areas. So, for poultry now, let's talk about poultry. For poultry, we have broilers, we have layers, we have turkeys, we have broilers. Those are the common ones that we know that most farmers raise. For broilers now, the vaccination schedule is actually, different from the vaccination schedule for layers. It's not so different, but for broilers, their production cycle is quite shorter compared to layers. Broilers most times maximum maybe 10 weeks, that like the maximum 10 weeks, and some it might even be more than 10 weeks, because I know my mom then when I was growing up, she used to raise broilers for as long as 12 13 weeks sometimes, and then they will go so big and fat. So it depends, but like the maximum that we know, some 10 weeks, 6 weeks, 8 weeks, 10 weeks. So their production cycle is quite short compared to layers. Layers can stay on your farm for as long as 100 weeks. I've seen some raise their laying beds to like 120 weeks. Yes. So turkeys too, their production cycle too is quite longer than that of. So broilers are still the ones that have a shorter production cycle compared to the other poultry birds. So you know that their vaccination schedules will be different. Please kindly mute your mic, sir. You're welcome. Please kindly mute your mic. Thank you.
Hello, please kindly mute your mic, Mr. Mohammed. Please mute your mic and close your video. Thank you very much. Please mute your mic and close your video. Thank you, Mr. Mohammed Namadi. All right, please can continue.
Okay, thank you. So for broilers now, I already talked about some of those vaccines that are given at day one at the hatchery. Marek is usually given at the hatchery. Newcastle and IB also, there's a particular dose that's usually given at the hatchery. Then when the birds get to your farm, you have to do follow-up vaccinations. For me personally, because I've worked in a diagnostic lab, for me personally, I usually advise, if you tell me to advise you as your vet, I will advise you to run a seromonitoring test on your flock. So seromonitoring means you're taking a particular sample from the birds, usually blood sample. Taking blood sample from the birds, blood sample and also some tissues for day-old chicks. You are taking those samples to the lab. So once these samples get to the lab, various tests are run on those samples, and then once the results comes out, you know the protection level. Like, so there are maternal antibodies that are transferred from the mother egg to the chicks. So some of these, because the egg that is used to hatch the chicks, there are some maternal antibodies that are passed down from the mother eggs to these chicks. And once these tests are run, we will now see how long will this antibody level, how long will this protection level, how long will it take them before it's neutralized? The neutralization level means when they are no longer protected. So they are protected for a period of time because of the maternal antibodies that are in them. But after a while, they're no longer protected. So the test will show you that in the next 5 days, these birds will no longer be protected against this disease. So the vets and the lab will help you check and will help you draw out a vaccination schedule. That okay, this is when this particular, maybe the one for Newcastle disease, this is when it's going to neutralize. This is when they will no longer be protected. So you have to come in at this point and then vaccinate your flock. For IBD, this is when it's going to neutralize. This is when you have to vaccinate them. I hope you understand what I'm trying to say. For several of the antibodies that are being transferred to the chick. So once they do this, you now have like a customized vaccination schedule for that particular flock. It might not work for another flock because as you are getting new flocks, you are doing the ceremonial test. So actually get a customized, a specific vaccination schedule for that flock. That is what I usually advise. I love working with flocks that have like test from the lab because it helps to, we're not just doing a gamble game. We actually, it gives us a direct approach to how to, take care of the birds. So once you get your vaccination schedule, although there are some common vaccination schedules that you can get based on the disease prevalence in the environment. So usually, most times when the birds get to your farm, and I usually advise parents and make sure that you are not in, because I know some people, you already have like maybe a 15-day-old or maybe 2 weeks old flock of poultry birds on your farm. Then you're going to get new day-old chicks, and then you put them in the same pen house with um with the older ones. I strictly advise against it. It's because when you now start encountering, some people say they actually used to get away with it. Fine, you probably got away with it a few times, but at the end of the day, it might still later catch up with you. So make sure as you are bringing in a new flock to your farm, put them in a separate place. They are still young. Don't introduce them to adult birds. And what are adult birds? Ones that are actually way older than a day-old bird. So put them in a separate place, away from other birds that have been on your farm for a long time, so that you can attend to them properly. Don't put them in a pen house and you simply are putting one long log of wood in between. They are still breathing the same air in that pen house. So try as much as possible to get a separate place, totally different from the ones that you've had on the farm before. I hope that is clear. I'm just saying this because I've encountered a lot of these issues before, and most times it used to lead to a lot of issues. So once you get to your farm, you already know the basic things to do. So if for those that probably will not do monitoring test, you can get a vaccination schedule from your vets. There are some common vaccination schedules you can get, and some of the common ones involves you doing I think Newcastle disease. No, most times it's Gumboro that comes first. Yes, Gumboro comes first because from experience and from data also, the maternal antibodies for infectious bursar disease usually neutralizes faster and earlier than that of Newcastle disease. So most times it's advised to give Gumboro vaccine first. So most times, some farms will start with Gumboro vaccine like day 7, and then usually 2 days after you can give the first dose of Newcastle disease vaccine, which is Lasota. And then usually I will advise, due to disease prevalence, actually, depending on your environment, you can now do 10 days after the first dose of Gumboro. 10 days after, you can now do a second dose of Gumboro vaccine again. Also, you calculate another 10 days from when you gave the first dose of Newcastle disease vaccine Lasota, and then give the second dose. That one is usually for broilers because they don't last too long because most times 6 weeks you've already sold them. So most times usually 2 doses of Gomboro vaccine and Lasota vaccines, most times that is given to broiler chicken. Usually not important to give. Some people will say, "Are we giving them fowl pox?" I don't think it's important. I don't know, but I don't know about, but it's usually not important to give them fowl pox vaccine. Most times, it's usually IBD and Gomboro vaccine and Lasota vaccine that you give to broilers. For laying birds, and while you are doing all this, make sure you, like, I will always hammer it in. Make sure you are practicing good hygienic, make sure you're practicing good hygiene. Don't just say, I've already vaccinated them, they will not come down. They will still come down if probably their environment is very dirty and not hygienic and other things are not in place. If the disease comes in contact with them, the antibodies that they have because of the vaccine that you gave them might not be strong enough against the strain of the disease that will hit them. So make sure you are practicing good hygiene. I cannot overemphasize that. Make sure you are practicing good hygiene. So don't just say you vaccinated them, you can just do anyhow. You are combining all these preventive measures so for your own purpose, for your own, at the end of the day, it's for your own good, because you're spending a lot of money. So for laying birds now, following the one we did for the broilers, the first dose, the second dose, for laying birds, I usually advise a third dose, and the third dose is usually 14 days again from the second dose. 14 days for Gomboro disease from the second dose, and also 14 days again from the date you gave the second dose of Lasota. As I'm saying this, like, you know how important it is to actually have farm record. So have a farm record is very important. So you know these are the dates that you did this, the dates you gave this, the dates you gave that. So it's not just in your head, because you can't keep everything in your head. You have to write them down. So keep good farm records. Make sure everything is up to date. Write down every little detail in your farm records. So I advise 3 doses of Newcastle, 3 doses of Lasota. And then, yes, definitely for laying birds, you have to give fowlpox vaccine. And the fowlpox vaccine most times is given between week 6 and week 8. Within week 6 and week 8, you should have given them fowlpox vaccine. Also, for some people, if infectious coryza is very prevalent, maybe you've heard from this person, from that person, and you are raising birds in that area and they're talking about coryza a lot, you might have to, although some people will say probably it's not like maybe good enough to introduce the vaccine to your flock if they've not come down with it. But coryza can be quite difficult to eliminate from your farm. So if you're very sure that coryza is very prevalent where you are raising your birds, I would advise that you give them vaccine against coryza. And most times it's usually given, I think, around week 18. That for laying birds though, week 18, 17, 18. And laying birds too. I'm still talking about laying birds. You have to give, because they are laying eggs, you have to give the 3-in-1 vaccine. That one usually contains Lasota vaccine, contains infectious bronchitis, and it also contains EDS, the egg drop syndrome vaccine. So it's like a combined oil, it's an oil vaccine that is given by injection to your laying birds, usually given within 16 weeks to 18 weeks, usually before they start laying. Usually at 16 weeks, you give them before they start laying. And it's very important to give them to prevent issues later in their production cycle. So you give them this 3-in-1 oil vaccine. And depending on the prevalence, because I always say don't just give because this person is doing this in Zamfara. I'm me here in Ogun State. I also have to be giving my birds because that person there is giving them. Make sure you note prevalence. If it's not prevalent, there are some things that are not needed. Although this 3-in-1 vaccine, it is very important. It is important and very necessary that you give your birds. Some after for this 3-in-1 vaccine, if you're going to be doing like a follow-up, because laying birds stay very long on your farm, if you're going to be doing a follow-up vaccination for Lasota and infectious bronchitis vaccine, IB vaccine, I will advise that you first take maybe after like 10 weeks or maybe let's say 8 weeks, between 8 to 10 weeks after you vaccinated them with the all vaccine at 16 weeks. I would advise you take blood samples of your flock to a lab to know if they're still protected against Newcastle and infectious bronchitis, because those ones are actually quite common in the environment. So don't just assume that because someone in this place said after giving the all vaccine, 6 weeks after, they started boosting them again with Lasota and IB vaccine. No, I personally feel, and it's very important that you are sure that they're no longer protected. So make sure you get your results from the lab to be sure that they're no longer protected, or in so and so number of days or weeks, these antibodies most likely would have reached the neutralization level. So you can now go ahead. So they will now advise you, the vets, they will now advise you, give them booster doses of Lasota and IB vaccine at so days, because at these dates, most likely they will no longer be protected against Newcastle and IB, because those diseases are very important for laying birds. They affect their production. So it's very important. So, and there's some people that they will say, okay, after giving the all vaccine, 6 weeks after, and then they do like booster doses every 6 weeks. But you don't have to always follow what people are doing. Make sure you know exactly what is tailored to your particular flock and your particular environment. Okay, I don't know if we have ruminant farmers here. One of the common ones is PPR vaccine, and PPR vaccine is usually given once in a year. We have FMD, foot and mouth disease. That one is also given. FMD is given twice in a year. PPR is given once in a year. We also have sheep pox, goat pox, like all those viral diseases also in ruminant animals. I think the sheep pox and goat pox, I think those ones are given twice in a year, but that one still depends on the prevalence. If it's not prevalent in environments, if you've not have cases of or occurrences of these diseases, I feel there's no need. But if there are occurrences and prevalence of these diseases in your local area, then I will advise you give them. Now I'll move to vaccine. Our time is already going, so let me quickly move to vaccine handling and administration. So some of the general principles of handling your vaccine. Get your vaccine from a good place, because I've had issues of people that will say they vaccinated their birds, but they will say I vaccinated my birds so dates, and like probably few days later, those birds will come down with what they put, like maybe they said they vaccinated them with Lasota, and then like maybe a few days after or weeks after, they're already down with Newcastle disease, and I'm like, what happened? And some of those farms probably even went on to probably do a laboratory diagnosis, and they were even never protected at all. It doesn't even show any titer showing that okay, they've been vaccinated recently. Some people will go to a store, because some of these sellers are very wicked. You go to a store and then you buy a vaccine, and probably that vaccine is either expired or is no longer valid. Is either expired or for some people that we know the power supply issue in Nigeria. So you're keeping your vaccines in the freezer, and those vaccines have to be kept at a particular temperature. Vaccines are usually kept at cold temperature, and you have to keep it in that cold chain till you administer them. Once probably maybe they now have power supply issues, or maybe they put off their freezer, and the temperature falls below where it's not supposed to fall, those vaccines will become inactive. They will no longer be good. They're no longer doing anything. It's just like if you're even giving them in their water or injecting them with it, it's like you're just injecting water. Nonsense. It's no longer good. So make sure you are getting your vaccines from a reputable source. Make sure the people are trusted. And when you're getting your vaccine, most people already know that you're going with your cooler, or maybe you're sure that where you're going to buy, they're going to give you maybe a pack to pack your vaccines with ice block and the likes, so that those vaccines, even you too, as you're carrying the vaccines home, no, if you're not using it that particular day, using it the next day, make sure you're keeping those vaccines in the cold chain till administration. As you are getting them is in block. If you are getting them, make sure you're transferring. If you don't have lights, make sure you are getting enough block on ground to keep it cold till when you're going to administer it. So make sure you keep vaccines are stored at the recommended temperatures till the time of administration. Maintain the cold chain during transportation and all. And also, for people that will be using the oral vaccines, like I said, make sure you keep it in the cold chain. Once you administer, there are even people that will they will put block inside the water that they are administering just to make sure that the vaccine is kept in a cold chain, which is good enough. So you're just trying to make sure that nothing happens to the vaccine, nothing happens to the validity of this vaccine. For people, most of those vaccines I mentioned, that the Lastota, the IB, the Gomboro, most of them are oral. Is they're oral vaccines. So if you are giving Lastota or Gomboro, it depends on the number of you already know. I'm very sure some of the people here already know how they do it. If you have maybe 100 birds, you're getting 100 doses. So one dose per bird. One dose per bird. So for the people that have maybe 50 birds, or maybe I think there are some people, because I think these manufacturers are producing smaller doses, like 50 doses. So because some farmers might have the issue of my beds are few, so why do I have to buy? You get. So for people that have maybe like less than 50 birds, I think there are some suppliers that sell 50 doses of the vaccine. So for let me use the benchmark of 50 birds. So if you have 50 birds, you're buying 50 doses of the vaccine. And you can also buy 100. If you don't get 50 doses, you can actually buy 100 doses. If you're doing 2 doses per bird, it will not hurt them. It won't hurt them. And a rule of thumb in vaccination, I should have mentioned it earlier. Never ever vaccinate a bird. If your flock is sick, if your animal is sick, do not vaccinate them. It can lead to some consequences that may not be nice, because at that point their immunity is already compromised, and you are introducing vaccines again. Like I explained earlier, the vaccine is the microorganism itself that you are introducing into the body, the system of the animal. So if they are sick already, that immune system is already compromised. The immune system is already doing a lot of work, like working overtime to get better. Then you're now bringing in vaccine again. It will just totally collapse, and it might lead to some consequences that you don't like. So never ever vaccinate a sick animal or a sick flock. Make sure they are well and okay. Then you can even get a go ahead from your vet that should I now go ahead to vaccinate them before you now vaccinate. So I was talking about oral vaccine. I'm using the benchmark of 50 doses. So for 50 doses now, if you are for 50 doses for 50 birds, or if you can't get 50 doses, you can actually use 100. You can double dose. You can use 100 doses for 50 birds. So if you want to give them in their water, the rule of thumb is that you use quarter of the water that they would normally drink in a day. So if maybe they can finish, let's say, 2 liters in a day, when you want to give them the vaccine, you make sure you use a quarter of that 2 liters. That's half. Like the drinker, 2 liters. So that means you're using like you're using half, no, not half, like half of 1 liter. Yes, half of 1 liter for the administration. So half of 1 liter inside the drinker is that's the amount of water you put inside the drinker. And then make sure you have starved them of water. Make sure they are very thirsty, because the way it is that for vaccine, like I said, you have to make sure it's in a cold chain till administration. So you will make sure that they are finishing whatever you are giving them within 3 to 5 minutes. They should be done drinking, because whatever they are drinking after 5 minutes, or maybe they are drinking up to 10 minutes, I'm not sure they actually already, the vaccine might have been invalid by then. So make sure you have starved them of water. I usually advise that probably 4 hours or 3 hours, 3 to 4 hours. And some people can do 2 hours too before you give them vaccine. 2 to 4 hours before you give them the vaccine, you remove water and feed them. Make sure they have eaten enough. So when you're introducing water to them, because they are very thirsty, they will all finish the water within minutes. Few minutes, they're already done drinking it. So that's what you should do. So you're using a quarter of the amount of water they will finish in a day, and then you are starving them for a few hours before administration, before you give them the oral vaccine. And once you are done, you wash your drinkers and then you put clean water. You can add glucose if you want. There's some people that will say they'll add glucose. You can, but sometimes it's just ordinary water. Ordinary water is okay. Just give them ordinary water, clean water, very clean water, and then they're okay. And make sure a day before and a day after, make sure you don't use any form of disinfectants. So disinfectants tend to break vaccines. We call something vaccine break. So don't use any form of disinfectants, because I know about some people that use some particular disinfectants or in their water, like to sanitize their water. And there are some of them that are actually safe for drinking. If they put these sanitizing stuffs inside their drinking water, it's actually safe to drink. But make sure that a day before, on that day, and a day after the vaccination, make sure any form of disinfection or maybe sanitizing agents, make sure you don't give them or is not around them, because it can actually break the vaccines. Because some people use the likes of maybe all those iodine-based polydine, because some people actually use polydine in water, all those kind of things. A day before, that particular day, and a day after, those things should be far away from the flock. Don't give them. Don't make sure they don't ingest them, because it can break the vaccine. For the some of those vaccines that you have to inject, because I know about the 3-in-1 vaccine you have to inject. The fowlpox, most times the fowlpox is given on their wing vein. For if you don't know how to administer it, get a professional, get a vet, a professional to help you administer it, because if you do it in a wrong way, it can have adverse effects on your flock. There's some people that will say they can inject and then they'll end up like destroying the leg of their birds, and then you see that laying bird, and probably that bird will not be able to walk again for the rest of his life. And then that bird, you now notice that it just starts getting thinner and thinner because it cannot walk to get to its feed. and then he cannot eat, he cannot drink, and then he starts getting slimmer, and after a while just die. That might be one of the reasons if you don't inject properly. So, before we wrap this up. Okay. Common vaccination is earlier. Not break the cold chain of the vaccine from the point you buying it and then to the point of administration. Do not break the vaccine and the cold chain is in a cold temperature till administration. Also, don't ever vaccinate sick birds. Also, make sure get your, it's not like you are giving expired or improperly stored vaccines. Look, you are doing vaccines in the right route. Make sure you are giving the vaccines. I've seen people give injectable vaccines via oral routes, and I've seen people give oral vaccines via injection routes. Amazing. There's a lot of amazing people out there. So make sure you are giving your vaccines through the proper route. And also make sure vaccination animals get vaccinated. That's why I said for the animals, make sure they're already they're very thirsty. So once you are bringing the vaccine water, all of them will rush it. So you are very sure that at least one bird is getting one dose. Make sure you vaccinate all animals, because in the case where some are vaccinated and some are not vaccinated, the ones that are vaccinated might end up introducing the microorganism or the agents to the ones that are not vaccinated. So you have to be sure that all of them are for people that will be injecting their flock for the injected vaccines, to make sure that all of them are vaccinated. And make sure you also follow the proper dosage and schedule. So make sure you have a good schedule. Make sure you have like the schedule that is good for your flock. And also follow proper dosage. Because if you go and over dilute the vaccine, if you over dilute, it will not work. It will not work. You just be giving them maybe ordinary water. It will not work. So I'll be wrapping up now. I want to be sure everybody listens to everything I said. I don't know. I know some people have been sending messages. I would attend to them very soon. So I hope you learned one or two from everything I said. And if you, how do I put it? From everything I've said now, I want to be sure that you now understand the importance of vaccination in poultry and livestock health. I want to be sure that you know how to get a good vaccination program, a good vaccination schedule for your flock. And then I want to be sure too that you've learned some practical tips in handling and also administering vaccines. Yeah, I forgot to mention handling too. For handling, especially for the injectables, handle your birds properly. They are not they are live animals too. They are not, so maybe handle them properly. I've seen the way some people vaccinate birds, and sometimes I'm like, these birds, some of them to do, because some of them might be able to take it, some might not be able to take it. Some might even develop some very, very crucial conditions after improper handling during vaccination. So make sure you handle them properly. If you're going to be injecting, for people that will be injecting on the thigh, make sure you are holding them. We're not just like mishandling them to administer the vaccine, to prevent future conditions they might not be able to help. Okay, I just said I should chip in that because I forgot to mention it. So I think I'm done now. So I'll
All right.
be okay.
Yeah, thank you very much. So please,
Okay.
if you have questions, kindly indicate with the hand icon. We can see some questions in the chat box and we are going to respond to them. So please, if you have any other questions, kindly indicate. Please, if you drop your question in the chat box, you don't have to raise up your hand again. If your questions are already in the chat box, you don't have to raise up your hand again. We are only going to attend to people that have not dropped questions in the chat box and they have questions. If you have questions, please kindly indicate with the hand icon. If your questions are already in the chat box, please do not raise your hand. Thank you very much. So we are going to start with the questions in the chat box. I can see two hands up already. Kindly note that we are going to attend to you. Okay, somebody is asking, please, how can we partition our pen so that we can have layers, broilers raised simultaneously? If I intend producing 500 broilers every 4 weeks, can I use a pen partitioned into two without any health hazard? So our facilitator, you have like just 2 minutes to answer that question. Thank you very much.
Okay. Okay. How can we partition? I advise against it. Some people get away with it. Some people do, but I usually advise against it. But if you must do it due to maybe capital constraints, you can raise them simultaneously, but they have to be the same age. That means you are getting them at day old. The layers and the broilers, they are both the same age. It's not like one is older than the other. They are the same age. So they are both day old. They are bringing in layers, they are bringing in broilers. But at a certain age, usually anytime from like 4 weeks, 3, 4 weeks, you have to get a separate pen house for each of them, for the layers and the broilers. So if you're even going to be in the partition for maybe a flock of layers and broilers the same age, you can raise them simultaneously, but within 3, 4 weeks. After those number of weeks, you have to find a separate pen for them. Then if you intend producing 500 broilers every 4 weeks, can I use a pen partitioned into two without any health hazard? If they are the same age, I won't advise you raising a 2 weeks bird and then a 4 weeks broiler also in the same pen house with just one single short partition. I don't advise it. Fine, you can raise them. So after a while, I feel you should get a place where you can always separate them. You can just try as much as possible to separate them. After 3, 4 weeks, separate them. I hope I've answered your question, because there are some health hazards that can come in. Or there are some certain diseases that maybe the 4 weeks bird can be able to maybe because they're already mature, they can still take it. And the younger ones that you are now bringing in, they might not be able to take it because their immunity is not as developed as the adult ones. So the younger ones might come down with some diseases because of the adults that you kept them with. I hope I've answered your question. Sorry, Femi, can I move to the next question? Hi, Femi.
Hello, I'm with you. I can hear you. I will just read the
Yeah.
questions for the sake of our people.
Okay, so I've answered the first question. I don't know who asked this. I'm Mr. Adebami Akinjole. I hope I answered this question.
Yeah, my mic was on mute earlier. Sorry.
Okay.
Already speaking. Okay, Mr. Adebami, we hope your question have been answered. If not, please you can drop a follow-up. Thank you. Mr. Simon is asking that, please, in case you skip your scheduled vaccination due to sickness, do you still come back to administer the vaccines after treating the sickness?
Okay. Let me use an example. Maybe your birds came down with Newcastle disease, which is very popular. Once they come down with it, it's a viral infection. So usually there's no treatment for it, but you can manage the situation. So at that point, you cannot vaccinate them with Lassa. So you just have to make sure you manage the situation till the birds are fine. You might lose some, depending on how bad the flock was hit with the disease. So in that case, once you've managed the situation and then they are now fine, like you notice that they are now back to eating and paying very well, that means they are fine. I don't advise to give the vaccine again most times. If that vaccine you want to give them, because they already came down with that particular disease, I know that they are fine. The ones that survived have already developed, because there's a way the body helps to, the immune system helps to fight the disease. Now they come down with the disease, they've already developed antibodies already against the disease, so there's no need to now vaccinate them anytime soon with Lasota vaccine. I hope you understand what I just said. Have I
All right.
answered your question, Mr. Simon?
Please, Mr. Simon, if you have any follow-up on your question, please kindly let us know. So this person, okay, we'll skip that one. Can one give 6,000 Lasota dose to 4,000 flocks?
Yes, you can. Yes, you can. Yes, you can. Like I explained earlier, when I was using the benchmark of 50 doses, that if you cannot get the exact 50 doses of the vaccine, you can actually double dose. So you can give 100 doses. If it's 100 doses, you can get. You can double dose. Double dose. You can. It's still safe to double dose. So if you're giving 6,000 Lasota to 4,000 flock, it is still okay. It won't pose any threat to your flock.
All right. Thank you very much. Okay, so someone is asking that what's the proper amount of water to dilute a vaccine?
Was Mr. Dr. Ibrahim, you were not listening when I was talking, or probably you were not in the meeting. So I already explained that if you are preparing your oral vaccine, for preparation of oral vaccine, you have to use a quarter of the total amount of water that they drink, that they would usually, that you're sure that they're going to finish in a day. I used an example of, if you're sure that maybe they're going to finish that drinker, that 4-liter drinker, if you're sure they're going to finish the 4-liter drinker and they'll finish it in a day, that's the amount of water they will usually drink in a day. Or you can actually even follow the standard, because there is a standard chart for the amount of water that each bird is supposed to drink in a day. So you can calculate that if you are not sure about the amount they can finish in a day. So once you do that, and probably what you get is 4 liters per day, that's what they will usually finish. Now you calculate 1/4 of that 4 liters, and 1/4 of 4 liters is 1 liter. So that means it's 1 liter you will use to dilute the vaccine for them to drink. I hope I answered your question. So if you have a follow-up answer, you can put it in the chat box.
All right, thank you very much. So someone's asking here that should IBD vaccine be given first to pullet? Because some start with NBV for them. What's your advice?
Okay, so this thing is relative, like I said, it's relative, and that's why when initially during the whole conversation, I was saying it is me as a vet. I find it easy to relate with flock that probably have a laboratory diagnostic test from a lab, like you did maybe a monitoring test on your flock. So I have something to work with, because these things I cannot see them with my physical eyes. What is happening inside their system? Do you understand? I can't what is happening. So most times we have to work with test results. But if you do not do ceremony, because actually there are some few cases that probably you run a monitoring test and they will say that the maternal antibodies for maybe Newcastle disease will probably neutralize faster than that of IBD. It is rare, but it can happen. For me, I usually advise that you give IBD first, because most times some of these birds come down earlier with IBD, which you use Gomboro against earlier than Newcastle disease. So I usually advise that you give IBD first before NDV. You can give IBD, the Gomboro vaccine, you can give them like maybe day 7 or maybe day 5, it depends. Day 5 or day 7, and then 2 days after you have given the IBD vaccine, the Gomboro, you can now give Lasota.
All right. Thank you very much. Okay, so someone asked here that in case 3-in-1 was not given and the flocks are 30 weeks old, can we still give it to them particularly when the flocks are having a lot of issues resulting in mortality?
So this kind of issue now, because you did not give them, once they start having issues, like maybe mortality issues and maybe production issues, your first result shouldn't be to give them the vaccine. Run tests, call your vet in. There's some things that because you've made a mistake of not giving them the 3-in-1 vaccine. So now what is the way forward? Call a vet in, or maybe seek the help of a veterinary lab. They should get their samples. So it's from those samples, the tests that are run on it, that will now use to decide, oh, this is where to come in. If it's that we are going to give them the vaccine, fine. If it's that we are going to treat, because if they are having lots of issues resulting in mortality, that means they're already down with an infection. So we have to treat the infection, manage what is happening to them first before now deciding if we will now later give them the 3-in-1 vaccine.
Okay, thank you very much. All right, so someone asked here that what is the vaccine for increase in egg production?
There is no vaccine per se that you give that will now help them to increase egg production. But the 3-in-1 vaccine, which contains ND, IB, and EDS, which are very, very important vaccines to give them against diseases. This because Newcastle, IB, and EDS, they affect their reproductive system and also their other systems. But for laying birds, they affect their production. So it's important that you give them that vaccine. That's the vaccine that will make sure they are protected against the disease that will make their production to decline. So there is no vaccine per se to increase egg production. Just make sure that you give them the vaccine at the right time to make sure that they are safe from the diseases that can affect their production, and also make sure that you are following good practices too. You are giving them good feed, good water, and also maintaining good hygiene. All those things, those are the things that will increase egg production. Laying birds will naturally lay if they are treated well, or if you feed them well and do the right things, they would lay. Just do the right things. There is no particular vaccine that will now increase their egg production. No.
All right, thank you very much. Okay, so move on to the next question. Can we still give IBD vaccine to layers that are still laying?
Most times, except I don't know, but they usually IBD vaccine is usually not given to layers that are already laying, they're already old. For IBD, is younger birds are actually very susceptible to infectious bursa disease because they still have their bursa. And after they get a certain age, the bursa will totally disappear. It will be resorbed into the body. So the bursa will no longer exist after a particular age. That's why it's called infectious bursa disease. So the bursa is usually present from day old till a certain age where it is no longer present. And that's where usually the disease acts on. So most times, older birds usually don't come down with IBD. Most times. I've seen some rare cases though, but it is not common. So I don't think it is not necessary as such to give IBD vaccine to layers because they're adult birds already.
All right, thank you very much. All right, so
yeah, the next question is, do you think, should I go on, Femi? Femi, can you hear me? Femi is still on this call. Okay, I'm not sure Femi. Maybe his network. So let me just continue with the questions. I hope you can hear me.
All
Okay.
right. Sorry everybody. My network, I had
Okay.
network issues. I had
All
network
right.
issues. My network just went off. Please, you can read the questions from your end. And also,
Okay.
please, for those of you that are sending questions, please kindly note that we'll be ending soon. So please, we'll be ending soon in the next 10 minutes or so. So for every question you have, you can drop it on the community page. Dr. Tewe is on the community page, and for every questions you have, she's going to respond to you. So probably you have some questions that you've asked before or you've been wanting to ask. Please drop it on the page. She'll attend to it as soon as she sees it. So please, you can read the questions from your end, and then we can round up. Thank you.
All right. Thank you. Okay, Mr. Adewale, you asked that do you think it is necessary to revaccinate married vaccine at day 23 for pullets? Yeah, for for some farms, it is actually necessary. Actually, farms that have had issues of marek, that probably older flocks have had issues of marek, and then you are bringing in a new flock. Most times, because in Nigeria, it's very difficult to trust people in Nigeria. So most people, they give a follow-up marriage vaccine. They give a follow-up vaccine once the birds get to their farm, because some people, they are not so sure that maybe the archery gave them at day one. But if the archery actually give them at day one, usually it's not necessary. But if marek is very prevalent in your local area or on your farm, probably older flocks have come down with marek, then you can do, I will advise actually that you do a follow-up marek vaccination. It's very important because for pullets is really, really important. I hope I answered your question, sir. Okay, Mr. Promise said, is it advisable to use sachets of milk in diluting lasota before administration? Yes, some people do, some people don't. So the reason why you use sachet of milk is because of the level of chlorine in the water. So if the level of chlorine is quite high, there are sometimes it can break the vaccine. So the reason for giving the milk, putting milk inside water, is to bring down the level of chlorine so that the vaccine will be viable to drink, like it will be viable. It's not going to break, because if the water has high chlorine level, it can break the vaccine. That's why some people usually use sachet of milk when vaccinating. All right, okay. What are the brands of Newcastle vaccine that are trusted and potent with high titer? So for this question, most times I usually don't like saying, oh, this particular brand is good, this particular brand is bad. The reason is because over the years, I've noticed that maybe they give this particular brand, the farm will say this particular brand did well, and then maybe some months down the line, another farm will say, no, this particular brand did not do well for my farm. I'm like, but it did well for this particular farm. What happened? So we know the way production works. Probably the manufacturer, maybe during production, they may do a particular one very well, and maybe a particular batch of vaccines that they now produce might not do well. So I really don't usually say, oh, this particular brand of vaccine is the best and that is the one that everybody should be using. I don't vouch for any I usually don't vouch for any brand, because I've done that in the past and it didn't go well. So just be hopeful when you're getting your vaccine that vaccine will do well. Get it from a reputable source. There are some brands that over the years, you can ask some other farmers, maybe for the past maybe 1 year, 2 years, which particular brand have you been using and has it been working well for you? You can go with that particular brand that person is using. But I don't usually vouch for any brand, because there are sometimes maybe another batch that they produce might not do as well as the previous batch that they produced. I hope you understand what I just said, sir. Okay, for broilers, is it necessary to give a third round of vaccine? Okay, I said it earlier in my presentation that for broilers, because their production cycle is short, I usually don't advise that you give a third round, because I feel it's not, except if you think that these birds will stay on your pen house, stay in your farm for longer than maybe 8 weeks, you can now give them a third round. But I usually don't have it, because most times, anytime from 6 weeks, some people start selling their birds, because some people at 6 weeks, their broilers have already reached slaughter weight, and then you sell them off. But if you know that your broilers might still be on your farm for longer than maybe more than 8 weeks, you can give a third round of vaccine. But if not, it is not necessary. Okay, please. Sorry, I think my okay. What is the difference between Komarov and Losota? Are they the same? If yes, which is better? So for Komarov and Lasota, they are both live vaccines. They are both live oral vaccines for Newcastle disease, both Komarov and Lasota. So we have different strains of vaccines, because there are different strains of all these diseases. So we have lentogenic strain. I hope you understand what I'm saying. So we have lentogenic strain, we have mesogenic strain, and then we have the velogenic strain. So the way I mentioned them is the way is how pathogenic they are. So for the lentogenic strain, it's still quite milder. Then after the lentogenic strain is the mesogenic strain, which is not as mild as the lentogenic strain. And then we now have the velogenic strain. For Lasota is the most common vaccine against the Newcastle disease. So Lasota falls under the lentogenic strain. It's very mild. But for Komarov, on the other hand, it's a mesogenic strain. So it's not as mild as Lasota. I'm trying to say it as plain as possible, and it's usually moderately pathogenic, and it can be used for both preventive and also maybe imagine. Some people actually use Komarov. Maybe some people do it. Some people advise that they can use Komarov against maybe an emergency vaccination, or maybe during an outbreak of a very maybe if the Newcastle disease is very, very virulent, and they can just use Komarov because it is moderately pathogenic, so you can use it to fight against the disease agents that came in contact with your flock. So that's the difference. Lasota and Komarov. The Lasota is milder. The Komarov, or the other, is not as mild as the Lasota. But Lasota is usually the most common, though. So you're asking if they're the same. They're not the same, but they do the same job, like they are vaccines against Newcastle diseases. Which is better? There is no one that is better. For if you are doing prevention, if you are not in a very, maybe your area is not an area where Newcastle is very, very prevalent, and maybe birds usually come down very easily with Newcastle. If that is not the case, then I don't think you should use Komarov. Just stick to Lasota. But if you are in a very prevalent area where Newcastle disease is very extremely endemic, then you can opt for Komarov for prevention. If we have layers of 46 weeks old that were given 3-in-1, then we have new pullets of 15 weeks. If we give the 15 weeks pullets 3-in-1, will it affect the old birds because they're in the same pen but separate cage, battery cage? This is one of the things I'm saying, because I know it is a very common practice among farmers. Why is a 15 weeks old bird in the same pen house with a 46 weeks old bird? Is an adult bird though. 15 weeks, they're still quite young compared to 46 weeks. There are some things a 46 week old can still take because they're already like adults, and their immunity has seen quite a lot. So their immunity is very developed compared to a 15-week-old bird. I don't advise. I actually stand against it when you are keeping 46 weeks old birds, laying birds, with 15 weeks in the same pen house. I advise against it. Most times there are some silent things that just creep in because of just this simple practice. I don't advise it. I usually don't advise it. So for that question, I would say no. Find a way to separate them, put them in a separate place, completely separate place. Don't put them together. It is not a good practice. There are some things that will come up as a result of you putting them together. Even though it's a separate battery cage, they're still in the same pen house. I don't advise it.
All right. I think we are going to take the last question for today. Please, further questions should be dropped on the page for the sake of our time. Thank you.
Okay. So someone said, is there a vaccine to be used to treat pox in Turkey or oral drugs? So there is a vaccine, the fowl-pox vaccine, to prevent fowl pox in birds, in turkeys, in your layers and the likes. So there's a vaccine to prevent it. But when it now eventually happens, maybe they now come down with fowl pox. Vaccine is no longer important at that point because it's already in their system. So their immune system is already trying to fight it already. So, but there's a way to manage because the viral infection, like I said, viral infections usually there's no drug against. Some people they will still tell you point blank that there are drugs against viral infection. It's just like HIV. HIV for humans is a viral infection. There is no treatment for it. You just have to manage it. So for viral infections like this, once they are done with it, the only thing you can do is manage the situation. So there are some drugs that you can use to actually manage the case of fowl pox once they come down with it, just to make sure that they are okay. And then the drugs majorly used to help their immune system. The drug is not like maybe acting on the agents, the disease agents. It's helping the immune system to fight back. That's what you are using the drugs for. So there are I think there are drugs like pox cure and the likes that just helps you to help the animal to boost their immune system to fight against the infection, the viral infection. But there's no vaccine to treat it. There is vaccine to prevent, but there's no vaccine to treat. Thank you.
All right. Thank you very much. So I want to appreciate everybody for thank you so much. And we believe that our facilitator was able to trash it out. If you have follow backs, follow ups, please kindly drop it on the community page. So I want to say thank you to everybody that has attended today's livestock hour. We believe that you've been able to get one or two things from today's session. I really appreciate you. And big ups to our facilitator for staying this long with us. Thank you so much. All right, so this is the end of the
Pleasure.
session. Till we come your way next time. Keep keep farming well, keep doing good, and see you all later. Thank you. So we can all exit the call now. The meeting has ended. Thank you so much. We can exit the call. The meeting has ended. Thank you.